Great, thank you. And we look forward to teaching you a little bit about pain and inflammation and how we can start managing it naturally with some of the materia medica today for injury, pain, inflammation, musculoskeletal challenges. Some pictures of my black belt degrees, putting in all that time in the dojo, you learn how to manage your pain without using a lot of medications because of the damaging effect of the medication. So it's a real skill to be able to heal yourself quickly. I was just telling Brennan that I injured my back last week, but in a week I'm totally fine, up and thing, and I was not in good shape. But it's the healing power of nature. And this is the arrows here are pointing to the phospholinositol 3 kinase pathway, which used to be considered the holy grail. If we could find herbs that inhibit the pain message here and here and here and here, then that, and also the SYK kinases here and here, by the way, then we can treat pain and inflammation very upstream. We don't have to wait. When you take aspirin and some of the allopathic drugs, you're like way out here. I mean, you're way beyond NF kappa beta. You're way out here treating everything downstream. The goal is to treat upstream. Find JAK inhibitors, find AKT inhibitors that are botanicals, and we know a lot about these inhibitors, which we'll talk about in the next couple of sessions. And then, of course, normal biomechanics. When we talk about osteoarthritis in our last session, we'll see how do we prevent damage to the cartilage like this through regular manipulation and understanding the biomechanics. We have a great chiropractor also co-teaching this masterclass with me. And he is fascinating and so knowledgeable about these body biomechanics and the forces generated throughout the what they call the chain. If your ankle's out, your shin's out, your knee's out, femur, the hip, and so interesting. Now, this is a good slide of where the counter irritants work, similar to the other slide, but more updated. So you can see where menthol and eucalyptus and spearmint. This is a new one that I think comes from a type of plant that the Jamaicans call monkey fiddle. Interesting plant there. Mustard oil, cinnamon oil, again, working on these TRPA1 receptors, even garlic, or that's where, like, if you put DMSO on a patient, which we'll talk about for pain management, that's kind of where it probably acts, and how it's going to inhibit pain, similarly to what we talked about. Now we talk about some herbs for pains. So one is Fang Ji, which is known as Stephania. And Stephania I've seen be very effective for autoimmune disease and sarcoidosis and lupus and silicosis. But I've also seen it good for types of arthritic pain where there's a lot of swelling in the joints. And the active ingredient of this particular pain is an alkaloid called tetrandrine. So you can go to this link and read about how this acts as an immunomodulating effect. So this probably wouldn't be good for trauma, but it's good for the pain of some type of autoimmune disease or arthritis. And these are some of the excellent articles looking at tetrandrine and Stephania there and how they block the TNF alpha. And you can find like a 5-to-1 extract where a fifth of a teaspoon gives you 5 grams of the crude drug equivalent, and the average dose is about 15 to 20 grams a day. So that would be like maybe half a teaspoon or 3/5 of a teaspoon of this particular very strong powder. This is a pretty overwhelming diagram, but back to my fancy biochemical diagram, looking at where the Stephania modulates, and the arrows and the stars are where it's modulating. So here, inhibitor kappa beta, here, here. So it seems to be modulating in a lot of different areas, and that's why it seems to be so effective clinically. Another one that's excellent are the Angelicas. The Angelicas are a vast family. That's why we put the word SPP, which means the whole lot of them, the whole bunch of species of them, because there's many, many different species of Angelica that's used in traditional Chinese medicine. Angelica gigas is one, Angelica duhurica is another, Angelica sinensis dongguai is another one. So most of these are very good for pain. Some of them have been shown to be one of the highest regulators of pain, but very specific for rheumatic pains, which are worse with cold and damp and wind. So if there's any type of pain associated with changes in the weather and changes with dampness and things like that, this is definitely one of those that's worse in the cold, the damp, and the wind, and particularly for muscle spasms, but joint pains too. And the dosage is usually 500 milligrams twice a day of the crude drug or more. I mean, you could do it 500 milligrams every couple hours in acute cases. Boswellia is another one that we use quite often in natural medicine. Is in the journal Phytomedicine here showed that it was a very powerful leukotriene inhibitor, and this was actually topical, not only internal. So Boswellia is one of those plants that can be used with other herbal agents topically for pain. Another one that is one of my favorite from Jamaica, and it also is used in China too, is called devil's ass whip, the common name. The Latin name is Acaranthes, and this is a key ingredient in many pain formulas. It has these steroidal saponins and phytoectosterones, steroids, which actually seem to help build muscle mass. We use it for sending the energy from the upper body into the lower body. So it's great. It's the most important herb in a Chinese formula, for instance, for aching back and knees and directing the formula into the legs, particularly if a patient has a lot of problems with their knees, legs, and ankles, and their upper body is strong. This is a classic thing that you'd want to use, the ox knee, about 6 to 15 grams per day. That's a photo I took on one of my trips to the Caribbean there. Now, peony is a very good plant that is one of the most powerful antispasmodics and really breaks up the blood stasis after a trauma. So this is after a trauma, you have that microscopic bleeding, and you want to move those waste products out of that area and bring in fresh blood. We use peony. They use in Chinese medicine the root of the white or red peony. Very specific for delayed onset muscle soreness or DOMS, which we have a whole presentation on when we do our case studies.